Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, good morning to you. How are you feeling?
Feel great. How do you feel?
I'm living it up. It's a great day as always. Glad to be on this side of the sod, as they say.
Yes, that's true. As long as we're above ground, we're doing well. That's
pretty
what they
good.
say.
That's right.
So we have a real treat for listeners today when they call to talk to you about their musculoskeletal pain. They get a free book. It's your latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And you can call right now, talk to Dr. Darrow, and get your free book at 866-870-5752. That's 866-870-5752, right here in the studio.
I like it.
Me too.
Would you like if I go to some information that was sent out to me recently?
Sure, would love it.
All right, so this is an email that was sent in, and it's a kind of a sad way to start the show, but it's pretty realistic from my experience. This doesn't mean that all back surgeries or neck surgeries go bad, because a lot of them turn out good, but this one turned out bad for this poor person. I'll read it. Lower back pain has been a problem since 2012. That's a long time. Have had the following procedures: spinal fusion L4-5. That was in October of 2012. Cervical spine surgery in 2016. And then another lumbar spine surgery 2017. And then when none of that worked, I had a spinal stimulator implant in 2021. So that's fairly recently. Results of the above is that I'm much worse now than when I started. My back is ruling my life. I have no pain when I sit, but increasing pain when I stand or walk. After all the spine surgeries, I decided on two things. No more operations and no opioids for pain. No pills for it. That's when I decided to try the spinal stimulator, which has provided absolutely no improvement in the pain. I'm hoping you can finally provide some relief, and I have recently started physical therapy to help with my posture and balance. So this is, I'm not saying this happens to everybody, because obviously the surgeries wouldn't keep going on if all of them turned out like this, but I get enough of them, and I've had enough of them over the years, that it's not something I want to have done, and it's not something I ever recommend to my patients. So be careful and be watchful. It's very seductive to think that a surgery is going to fix things for you, but I'm maybe the last stop in town after people have tried everything else, because regenerative medicine, using platelets from your blood or using your bone marrow, is something that is still on the forefront and is being tested every day. There's a lot of research on it. My book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, is all about that. There's 256 studies all through, and you can see them all at the end here, showing why surgery really is not the best thing to do. It's very invasive. Are there cases where it absolutely needs to be done? Yes. If you have a broken bone, go get surgery, if that's needed. Sometimes if someone comes in with, let's say, a dead leg or arm, you need surgery. There's a nerve impaction. But a lot of these surgeries for necks and backs end up being failed. That means that they didn't work out right. And, it's a shame to say that Kathleen, who called us up a couple of years ago, his husband actually died from a neck surgery. Kathleen, I hope you're listening. We love you. And These are not easy things to do. Even in the best of hands, there are mistakes, human mistakes that take place during surgeries, even little surgeries. Necks and backs are very complex, but even teeny little surgeries I've seen go wrong with people getting infections and having worse problems than they started out with. So be very, very careful. It's much easier to be able to regenerate tissue and get rid of pain that way. It's just injections. We call it PRP or stem cell injections. And it's very simple to do. You walk in the office, you get injected, and you walk out. Even if it's your knee or your ankle or your toes, we do the whole body. Necks, backs, shoulders, rotator cuff tears, elbows, wrists, fingers, hands, hips, knees, you name it. I do the whole body. Plantar fasciitis on the bottom of the foot. And why would you consider getting a surgery when you could potentially heal yourself? And I say heal yourself because, in essence, all we do is we stimulate the body to produce more collagen, which is a major constituent of cartilage, which is in the joints. So it's a natural healing, and it's something I've been using on myself, self-injecting myself for the last about 23 years or so. And it's worked on me every single time I've done it. It's not going to work on everybody. There are many reasons why it doesn't work. The most common is that people try it and they don't get the results they wanted and they quit. It may take one time. That does happen, and it may take several times. We just don't know. I can never project in the future as to what's going on with someone. Even if it's something super simple, it may take a few injections to get better. So I'm going to ask for callers. I love talking to you guys instead of just shooting my mouth off. So I'd love to hear from you. And the phone number to the studio right now to talk to me live is 866-870-5752. That's 866-870-5752. And if you're shy, I hope you're not, because we'll be good to you, we'll love you, and we want to hear what you have to say because you're going to help thousands of other people by calling in with your issues or your family's issues or your friends, whatever it is. If you don't get to us during the show, the number to the office, and people are usually by the phones there, is it's 800-300-9300. That's 800-300-9300. So we would love to talk to you.
Absolutely. The number again is 866-870-5752 right here in the studio. You can speak with Dr. Darrow, and you can get the free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Shall we go to Susie?
Susie, yes, we should. Dr. Marc Darrow, you had neck surgery. Oh, no, I'm sorry, your neck hurts.
Hi, thank you, doctor.
And you had an injury. Yeah, what happened? How long ago?
Yes, Dr. Marc Darrow. Hi, thank you for taking my call, doctor.
Yes.
Happy holidays. My husband has been in a rear end car crash, so he has neck pain. Whenever I mention your wonderful stem cell, your wonderful show, he gets scared and says, I love what you're saying. I agree with stem cell, but I'm scared to do it in my neck because of the danger. He doesn't want to be paralyzed, so I don't know what to say. How can I help him understand that it is possible to cure yourself and not have surgery?
I think the best thing is if you can drag him into the office, like a lot of spouses literally drag their significant other to the office, and we can sit down and talk about it. And I can go through everything that I know about, spend as much time as you need, and then he can decide what he wants to do. I have to do an examination to...
Like you say, I listen to your show every Saturday. Nobody ever touches his body. They don't touch his neck. The surgeons, they just tell him, you should do surgery. Nobody touches him. They don't examine him in any way. They just tell him, let's do surgery, open you up. And I would be terrified to have him go through all that and have no result or worse result.
Yeah. I don't know how you spell the word insanity, but that's insanity, okay? To me it is. Because, and this happens all the time where patients come in after a failed neck or back surgery or knee or ankle, whatever it is. And I always ask, did the surgeon touch you? No. They looked at an MRI or an X-ray and told me I need surgery, and then I got suckered into it and it didn't work. So, we tend to put the surgeons up on a pedestal. That's been our culture for many, many years.
Exactly.
And those days are going away because of the internet and because we're getting smarter and we're seeing too many of our friends and family having surgeries that failed. So I'm not making a negative statement about surgeons because really, they do the hardest work in medicine. That's very dangerous work that they do. And they got to be sweating all the time when they're doing it and then dealing with the after effects of it. So, if you turn your radio off, Susie, if you turn your radio off, we can get rid of that echo.
Yeah, thank you. Sorry about that.
Sure,
I feel
no
like
problem.
Going to Vegas. If he does surgery, it's like being in Las Vegas.
Well, I agree. You don't know what's going to happen. I'd say probably half the people I see who have a surgery come out good and half come out bad. And that's not good odds for me. And I'm the prime example. I was on the course of becoming an orthopedic surgeon. I'd done a lot of research in orthopedic surgery, and I was offered a slot to do it, and I turned it down because I had a shoulder by my orthopedic surgeon professor on my shoulder, and it came out awful. I didn't blame him for it at all. I loved my surgeon, but it's just what happens. And my shoulder got much, much worse. And it wasn't until a few years later that I discovered doing regenerative medicine where I self-injected my shoulder. And this is a funny, funny story. My wife was lying in bed watching TV, so I jumped in bed with my syringe. And she goes, "What are you doing?" But she was using expletives, kind of swearing at me. And I said, I did this on my wrist, and it worked on my wrist, so I'm going to try it on my shoulder. And my wife is a nurse practitioner, so she put up with it. And I injected my shoulder, literally sitting there in bed. And I woke up about 12 hours later in the morning, and my shoulder was 100% pain-free with full range of motion, which I didn't have before. Now, that was a real wake-up call. My wrist was first, and that got better 24 hours later. About 50% better. I then self-injected it, I don't remember, 2 or 3 or 4 more times, and it was 100% better. Wow. And my wrist has not bothered me. It's got to be over 20 years now. And I can play golf. I can do whatever I want. I weight lift. So I'm not making this out to be a miracle because it's not. Don't get the idea that it's a panacea for all things. It isn't. You got to pick the right patient. You got to examine them, see if it is in the right area for where this can work. So there's a lot of things it's not going to work for. I get emails every day. Please do stem cells on my multiple sclerosis, on my vision defects. These things that it's not going to work on. Now there are studies being done on that at universities, but I don't do IV stem cells. The FDA doesn't like that, so I don't do it. I do orthopedics, musculoskeletal. But let me talk to your husband and, drag him in the office sometime.
I've never thought about dragging him in. I'm always waiting for his consent. I need to be a strong lady and drag him.
Well, listen, we can't change the course of other people's lives. And your husband, here's what one of my best friends used to say. When you get sick and tired of being sick and tired, you'll change. No. And maybe his isn't bad enough. It's not bad enough for him at this point. But surgery certainly is not an option until you've checked this out and had someone who does this kind of work examine him.
Thank you so much.
Susie, God bless you. I appreciate your call.
Thank you, Susie.
I love your show. I listen every week. Love it.
Oh, thank you so much. We appreciate that.
I've heard your story about laying in bed with your wife and every time I love listening. It's so funny.
It is funny.
Meet you and have my husband come in, and hopefully you can have treatment for him.
You know what's funny also is in the beginning of my sojourn with regenerative medicine, we used to call it prolotherapy in the beginning days, which means to proliferate or stimulate new tissue growth. And then the trendy word became regenerative medicine, which is really more accurate because we're regenerating or growing back more tissue and healing the area. But it's been something so amazing in my life. And since it worked on me, I started literally begging my patients to let me try it on them. So I was experimenting on people. And it seemed to just work so often that it became the mainstay of my practice. I stopped using drugs and physical therapy as much. And I mean, I rarely ever prescribe drugs to people. Usually I wean them off of opioids, narcotics.
Yeah. The body has such an amazing ability to heal itself.
It really, really does. Yeah. And, for me, when I've self-injected and I've gotten better, there is a lift that takes place when the pain goes away that is so amazing. It feels like you died and went to heaven, but you're still alive and feeling great. It's just amazing.
Wonderful.
Yeah. Well, thanks, Susie. I appreciate it.
Like pain affects your life every day. It affects you negatively. You can't do the things you want to do with your family.
It's depressing. It's very depressing.
Yeah. Thank you so much, Doctor.
All right. Well, thank you, and God bless you and your husband, and drag him over.
Thank you. I will
make a deal that I'll just examine him. Nothing he has to do, and then he can decide what he wants to do after he talks to me.
That's a great idea. Okay, I will use those words. I'm doing it. I will see you soon.
All right. Thank you so much.
No, goodbye.
Yeah.
Thank you so much, Susie. Our number right here in the studio is 866-870-5752. You get a free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And you're also in her new book.
Yes, thank goodness. Suzanne, you are a godsend to the new medicine. I'm going to call it the new medicine because the word alternative is definitely not accurate at all. We stay away from drugs and surgery and things like that, but it's the old medicine. It's the old medicine, but it's the new medicine. It's been around since the beginning of time, and there were people that were doing this probably back in the caveman days, using herbs and things like that. And then when more modern times came along, people started creating medications, and then the drug companies took over, and then the surgeries took over. And to me, it's very sad. It really, really is when I see patients who come in whose lives have been destroyed by medication and surgery. I'm sorry, that's just the way it is. And again, I'm going to say it. It's not a statement against surgeons. I love them, and they're needed, but there's too many of these surgeries being done that just shouldn't be done. So, Nita, I've got a couple things to mention. One is in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There's a chapter in the back on injecting the face to make people look better, and that's called the vampire facelift. And very simple. We just draw your blood or get your bone marrow and get stem cells and put it into the face with a skinny little needle. And people look better literally the next day because it's regrowing the collagen in the face. We dry out as we get older. And then we also do something that I'll call hair regeneration, which is growing hair on the top of the head. It won't work on Dr. Phil. He doesn't have any follicles left. But if your hair is thinning, then it's a great thing for you to stimulate more hair growth on the top of the head. So I love what I do, and I love working on the musculoskeletal system, and I love watching people get prettier. Men and women love the vampire facelift, so that's something that you can do also. So, Nita, it's Stump the Star right now. Are you ready to be...
Ready.
Okay, you only get 2 seconds. Why were the fish's grades bad?
Because the scales were tipped.
That'd be a good one. They were below sea level.
Ooh. Okay.
You didn't laugh. I'm going to do one more until you laugh.
Okay.
Why did the stadium get hot after the game?
Because the sun was out.
That's good, but not as good as mine. All the fans left.
Ooh. That's a good
Okay, one more.
Okay.
One more. Maybe you'll get this one. Because a few shows ago, you actually got 2 in a row.
I know, that was amazing.
What do you call banana peel shoes?
Banana peel shoes.
Slippers.
Oh, that's a good one.
I knew you would love it. So let's go to a question now. Let's see what we got.
Okay.
All right,
Do you
so
want
everybody...
to give the phone number first?
Sure. The phone number is 866-870-5752. I'll repeat it for you. It's 866-870-5752. Call me now. You've got a little time left here. Please don't wait till the end of the show. Then it gets all jammed up and we won't get to you. We love you. We'll take good care of you. And we want to answer all of your questions about musculoskeletal pain, about platelets from the blood, PRP, stem cells, and how you can actually heal your body. So let's see. Everyone listening who knows me knows that I do the entire body, all the joints, necks, backs, bottom of the feet, back of the head for headaches, things like that. But this one is very specific. This question says, hello, the middle finger of my right hand is very stiff most of the time now. This is going on for a few months. Do you treat this type of issues as well? Yes, I do. There are some things I can help. There's certain things I can't help. So with a stiff finger, we can think about things like osteoarthritis, which is super common with people. It's usually from a trauma that maybe they're not aware of. It can happen from baseball players when a ball hits the tip of their finger and jams the finger. And then they end up with a node, like a thickening around the joint. And that's something that I have very, very good success with. It can be all the fingers. There are a lot of people that come in, especially a lot of females that inherit it from their moms. So if you have a lot of those nodes on your fingers and your mom had them, that's actually hereditary, but it's still something that we can help. And what I see after the injections using platelets or stem cells is that those nodes actually shrink down and the pain goes away. And fingers usually heal pretty quick. Sometimes people have what's called a trigger finger where it catches. And that's a little more problematic, but that's something that potentially could be healed. Sometimes people have rheumatoid arthritis, and that's very complex. We often have to change their diet to stop the inflammation and get them on what we call an alkaline diet, so the acids in the body are not attacking the joints. People can have psoriatic arthritis where their fingers, what we call the pathognomonic sign is pencil in the cup, where the joints are actually being eaten away. We can help with that. Sometimes people get Dupuytren's contracture where they get a thickening of the tissue on their hand, and there's things that can be done for that. So yeah, there's a lot that potentially could be done, but as I always tell people, don't email me your MRI, your X-ray. Bring it with you. I like to see it, but I need to examine the area to see what's going on. Nobody can diagnose based on imaging. It's a good thing to get because you find things that you don't necessarily see. As an example, I had 2 trigger fingers, one on my middle finger, one on my thumb, and I went across the street to an orthopedic surgeon buddy of mine, and he did an X-ray, and he said, well, I don't see anything there. And then I said, blow it up real big, and he did on his computer, and he saw a little what we call a Ditzel fracture, a teeny weeny little fracture at the end of the joint. And then we knew what was going on. It wasn't really a trigger finger. It was inflammation from the fracture. So medicine's complex, guys. There's a lot you can do. Hang with us. We're going to a break. And you can call us on the show, 866-870-5752. And we'll talk to you very soon. Hang on with us. Don't go away.
Stay with us. You're listening to Living Pain Free with Dr. Marc Darrow, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.